Good morning. It's Friday, February 20th. This is Josh Evans, Vice President of Government Relations for IARF, and this is your low-tech IARF weekend session video update. We'll start off with everyone's favorite segment, the bill count. As this video goes to recording, there have been 4,118 bills, 338 resolutions, and 46 joint resolutions filed in the House and the Senate total, and there has been 15 executive orders. You can expect all these numbers to go up until next Friday when we reach the introduction deadline, and then the process of weeding through these bills will begin in earnest as the General Assembly takes these up in committee, etc., etc. Clearly, the most important item we want to talk about in this week's update is Governor Rauner's FY16 budget address, the first of his career as Illinois governor. And it should be noted a couple of items of importance. With respect to the FY15 budget, as members and non-members know, the association has been loudly advocating in the General Assembly to ensure the FY15 finishes out without any cuts to community-based mental health, DD, and early intervention services. We're pleased to report, based on our initial analysis, that Governor Rauner and OMB agree with us. It seems as if DHS and the various divisions will be requesting an FY15 supplemental aimed at keeping community lines whole, meaning it doesn't seem as if they are going to ask for any cuts in the FY15 budget, nor does it appear as if they're asking to delay payments in the FY15 budget. I think so far we can say this is, well, not a victory because it's not yet inked. We can say we're having an impact in terms of the outreach we've done to OMB in the governor's office, as well as the outreach many of you have and continue to do with your legislators back home. Governor Rauner said in his budget address, and this was echoed by Speaker Madigan in post-budget address comments, that he thinks that the FY15 negotiations will wrap up soon, and we certainly hope that that will wrap up favorably for the community system. The FY16 budget request, however, was a mixed bag. I think kudos should be given to the Rauner administration, and particularly DHS, for doing everything they could within this fiscal environment to try to preserve core community-based services and supports. As such, we see no evidence of any Medicaid rate cuts to community-based DD and mental health and substance use services. However, we do see a rate cut being proposed for ICFDDs at about 12%, totaling about $46.1 million. And we do see a number of flat-out grant eliminations and grant cuts, both in the division of DD and in the division of mental health. And finally, it looks as if the governor is going to propose a substantive change to the early intervention program with respect to delays that would, I think, have the impact of about $28.1 million in the FY16 budget. So while the governor's office attempted to try to preserve core and essential community services, due to the fiscal impact, it just doesn't seem like it was possible in their ask. And unfortunately, all of the grant cuts as well as the rate cuts that were proposed will have, we know, the effect of destabilizing both the community, DD, and mental health system. So our task now is to continue to go over, here it is, the turnaround budget by asking questions and investigating additional information. We hope the Department of Human Services and Healthcare and Family Services and DCFS will produce in the coming days, so we can follow up with you a more concrete update on what we understand to be in the governor's FY16 request. We'll continue to contemplate what we've sent out to legislators, members, and non-members alike. A lot of red on that sheet. Which were the cuts that were proposed in the budget. The next logical step will be to assess what the impact of that budget is and begin the process of conveying that impact to legislators, members of the media, general public, etc. Please report our Grassroots Advocacy Committee will look to meet on Monday afternoon and begin that process, or actually rather continue the process of developing the message and the data requests on the FY16 budget, so members are fully prepared to talk about the impact and certainly work, as Janet said in her statement to the press, work on a different outcome than was proposed on Wednesday. Moving on to substantive items in the General Assembly, there have been some things that we're definitely keeping our eye on that have been filed this week, particularly House Bill 1344 and Senate Bill 1367. These were introduced by Representative Greg Harris and Senator Heather Stearns, respectively. And it seems as if what they're trying to do is get in on the front end of any possible Medicaid reform efforts that will be proposed by the Rauner administration, particularly under an 1115 demonstration waiver. As we understand these bills, it would basically inject the General Assembly in a more formal basis and having some oversight of demonstration waiver proposals, which I think this is, at this juncture, based on what was included in the 1115 waiver by former Governor Quinn, is probably a good thing. We have no position on these bills. We'll follow them closely and we'll report back any information we gather on those to you. We are pleased to note that due to some conversations we had with Representative Sarah Feigenholtz this week, she is going to look to file an amendment to House Bill 205 that would incorporate some requests we made of DMH all the way back in October to provide some regulatory and process relief to community mental health providers. And that is, she's going to file an amendment that's aimed at removing DMH's requirement to do income verification for Medicaid enrollees in CMHCs, which we know costs a pretty penny to these providers monthly. And in addition, the amendment hopes to direct the division to make amendments to Rule 132 to expand the definition of qualified mental health professionals so that we have a broader pool of employees that could be used. Have to ignore that. Sorry about that. Apparently I should have turned the phone off. So we can have a broader access a broader pool of mental health professionals for community mental health centers. Additionally, we're pleased to report that Senator Dan Katowski has filed Senate Resolution 148 and Representative Greg Harris has filed House Resolution 160, which is the Association's Certified Community Behavioral Health Clinic resolutions that would urge Governor Rauner to take steps working with stakeholders to apply for a pre-planning grant from the federal government so that Illinois can further investigate and work towards becoming a demonstration state for CCBHC. There are 9 statewide and national organizations that have signed on to that. Look for a position paper from us soon. And we certainly hope all of our mental health providers and IARF will be talking to their legislators and urging them to co-sponsor those important resolutions. In addition, we see that Senate Bill 12, which is the legislation Senator Maddie Hunter has over in the Senate that would ensure a minimum wage increase is not an unfunded mandate. Work continues on that bill. An amendment was filed this week that didn't get taken to committee, and the association continues to work with Senate staff and Senator Hunter to ensure that in addition to any possible statewide minimum wage increases such as occurred with the City of Chicago ordinance on minimum wage would be addressed as well. More on that one soon. We also learned that Senator Staines and we believe Representative Gable will again be filing legislation to increase the DSP wages for our DD service providers over the next few years. We don't have any bill numbers on those yet, but we expect to have those filed and we'll provide that information to members by the end of next week. We'll wrap up by noting that the Senate is not in session today and will not return until March 3rd. Meanwhile, the House goes in at 10 today to do some work on the floor and some committee work today, and they will be returning next week on the 25th. So look for another update next week. Nice to present to you, and as always, feel free to give me a call or send me an email with any comments or updates.